and welcome! Today, we will explore LO1, Understanding Atypical Behavior. In this session, we'll examine what defines atypical behavior in psychology, how it is identified and classified, and how cultural and social factors shape our understanding of what is considered normal or abnormal. Atypical behavior involves thoughts, emotions, or actions that deviate from societal norms. The concept of normal varies across cultures and times. Psychologists identify abnormality through four main methods. Statistical infrequency considers behavior rare if it is uncommon. However, rarity does not always indicate disorder. Behavior is seen as abnormal if it breaches societal norms. For instance, talking loudly to oneself in public. Social norms differ across cultures, posing a challenge. Mislabeling nonconformity as illness is a risk. This approach can reflect bias rather than true disorder. Abnormal behavior can hinder daily life functioning. Indicators include distress and unpredictability. For example, severe depression affecting work. This method emphasizes real-world impact. It is clinically useful for identifying functional impairments. Jehota's model views abnormality as lacking positive mental traits. Traits include autonomy and stress resistance. Few meet all ideal criteria, risking over-pathologizing. This approach highlights the complexity of mental health. It challenges the perception of normal human struggles. Once identified, atypical behavior is classified. Classification systems offer standardized diagnostic criteria. The DSM and ICD are the primary systems. They categorize disorders into specific groups. This aids in consistent diagnosis and treatment. The DSM is a key tool in psychiatry. It categorizes disorders like anxiety and depression. Each has specific diagnostic criteria. These include symptom lists and duration. The DSM aims to enhance diagnostic reliability. The ICD is published by the World Health Organization. It covers both physical and mental disorders. Mental disorders are listed in Chapter 6. The ICD is globally recognized and culturally sensitive. It provides clear diagnostic guidelines. Classification systems face reliability issues. Clinicians may interpret symptoms differently. Validity concerns arise from overlapping categories. Cultural bias can skew definitions of abnormality. Labels can lead to stigma and discrimination. Rosenhan's study exposed diagnostic flaws. Participants faked symptoms to gain hospital admission. Once inside, they acted normally but remained diagnosed. This highlighted issues in distinguishing sanity. It showed the risks of misclassification in psychiatry. Cultural and social factors. Here are some examples. Classification systems often follow the medical model. This views mental disorders as illnesses. Critics argue for considering social factors. Over-medicalization can pathologize normal reactions. A balanced approach is crucial for accurate diagnosis. Defining atypical behavior is complex. Cultural relativity influences definitions. Subjectivity in judgment affects reliability. Overlapping symptoms challenge validity. Labels can stigmatize rather than clarify. Definitions of abnormality evolve with society. Homosexuality was once seen as a disorder. Social values influence classification changes. This questions the objectivity of mental health labels. It highlights the need for adaptable systems. Defining and classifying atypical behavior aids diagnosis. However, cultural bias and subjectivity pose challenges. Classification systems must be used critically and carefully. They are useful, but not infallible. Understanding their limitations is crucial for fairness. Should you have any questions, please contact us via WhatsApp at 07484 361 688. Our team will gladly support you. Thanks for your time, and see you soon!